Should we talk about what's buzzing all over the world?
What's buzzing now?
Peptides.
Peptide. Great topic. Love that topic. Yeah, it's definitely a big buzz right now. So yeah, let's talk. See if you think it's something that's gonna stay or if it's one of these trends that's gonna go away. I think it's here to stay, to be honest.
Yes.
So yeah, welcome to the podcast. This is Dr. Abraham. I'm here with Lindsey.
Yes,
Nice to have
thank you for
back.
having me.
Yeah, we're talking all about peptides today. Many of you already have heard of peptides. For those of you who don't, it's how would you explain peptides?
So a peptide is not like a full-blown protein, but it's like a piece of a protein. It's a little small chain of like 2 to 50 amino acids. And basically there are peptides throughout the body, throughout the cells, and they kind of can aid in cell function or function of the organs and the tissues in your body. And basically the way that I explain it to patients is that the body is aging and cell function kind of diminishes over time from oxidation, kind of changes in circulation, lymphatic processes, and the cell function starts to weaken over time. So peptides can be introduced topically. Some people use them through injections, and they kind of boost the cell function by either contributing peptides back into the system to help aid certain things. There are carrier peptides that bring minerals to the cell for cell function, signal peptides that help enzyme activity or can regulate hormones, for example. There's neurotransmitter peptides like what's in Daxxify, which is an FDA approved neurotoxin that we use. And so peptides can kind of be replenished in the body to help aid in cell function.
That's a pretty good explanation. Awesome. And I think some people have heard of certain peptides, even if they don't know that these will fall under that category. Because as you mentioned, peptides aren't like just one or two things. It's a whole category of drugs or medications, and some are more popular than others. I would say some have more research than others, so peptide therapy isn't all the same. There's some that have FDA approval, as you've mentioned. Some where again there's a lot of research, maybe even if there isn't FDA approval yet, and some they're very new, and don't have as much research behind them yet.
Yeah, and in the US we have like a pretty rigorous process to go through that costs a lot of money and is very tough for some of like the companies to get through to get FDA approval. In South Korea, there's a lot of innovation for the peptides. Europe is like the massive global market of peptides right now. And then in the US, we're seeing them, but there's not there's some that are FDA approved, Ozempic, Mounjaro. There's a blood pressure medication, there's an HIV medication. So medically, they're starting to be approved here for serious conditions, and aesthetically, we're not quite there as far as FDA approval. Although topically, there have been some approvals like with skincare products, and then also with some injectables like with Daxxify.
Gotcha. So what would you say are the most popular peptides that you hear people asking about, or you just kind of hear about in general?
Yes, I feel like so many patients now, I'll mention peptides or ask them if they know anything about peptides, and they tell me that they just ordered their peptides online, injectable peptides. And so I think there's a wild west of brands out there right now, and the quality may vary. And the effects may vary, but a lot of people are getting targeted through social media, and they're buying their peptides online and injecting them at home, which may or may not be a good idea. But a lot of them are doing kind of like a glow type peptide, which has like the copper peptide, which can help with a lot of wound healing, collagen synthesis, and is an important like delivery system of the copper mineral to the cells. Another one is BPC 157, which I've practiced with for quite some time and seen numerous benefits with patients. And BPC really can help with soft tissue injury and repair and cell signaling, TB500. There's like Wolverine stacks, there's growth hormone peptides, and then of course like the Ozempic is a massive one.
And that's, as you mentioned, sometimes there are some popular peptides like, you were talking about Ozempic and some of these other medications that maybe people don't think of as peptides, but they are very, very popular, and as you mentioned, the BPC 157 and some of the other ones. NAD plus is also very, very popular.
Yes.
And but as a lot of people when they think of peptides, they're only thinking about the growth hormone or growth hormone releasing hormone or the BPC 157. But there are definitely other medications that would fall under that category.
Yes. Even like the salmon DNA, the polynucleotides are very similar, and a lot of times they'll be inside an exosome with other peptides to kind of like just help with cell regeneration, cell signaling. And skincare products now are really heavily utilizing peptides.
And you've kind of also mentioned that, or referred to it, which is sometimes peptides are used in combinations. So like whether it's something like it's called the Wolverine stack or glow stack or the growth hormone releasing hormones. Sometimes it's a combination of different peptides because there is that idea that they can work synergistically together to just kind of give better results, whether it's things like tissue healing or whether it's things like improving some hormonal regulation in the body or some of the other benefits. Again, we're not saying that all of these benefits exist. Some of them there's definitely more research on, and some of them are still kind of like newer topics, and there's more research is needed. As you mentioned, it's kind of the Wild West out there, but oftentimes what I see is when it comes to things like that, people are either kind of one of two camps, either like peptides are like the best thing, and anything that's a peptide is good for you, and anything that's a peptide is going to solve all your problems. If it's just it could be the newest thing that you just see somewhere on social media, and just because it has the word peptide in it, you think it's going to work. And then there's also another camp who's like, there's not, anything that's a peptide doesn't work. It's like, oh, peptides are complete BS, and there's like no evidence, no research, and a lot of times people tend to kind of like, when there's something where there's any sort of gray area, people tend to either go one way or the other. But I feel like a lot of times the truth is somewhere in the middle. Like some peptides are great and they're very, very beneficial. Some things might not be. It might not be best to kind of try these other ones just yet. So
yeah, I think that ideally someone isn't just ordering them online and utilizing them, because the quality might be variable. And then also, to your point, it's like some peptides might not be appropriate for certain people with certain conditions or at a certain age. But definitely sourcing them, usually through an office like ours or some type of facility where you have a provider that can kind of manage the treatment as well, and just kind of be monitoring you over months while you're doing the peptides would be ideal.
Yeah, and there's also like, with these online places, usually there isn't really much regulations going on, so you don't know if you're even getting what you're ordering. So, it's just another thing to kind of keep in mind.
Yes, exactly. And but otherwise, I'm very excited about peptides because in general, they can kind of just help your body behave a little more efficiently and potentially a little more youthfully, so that these processes like inflammation and old injuries don't get all dysregulated and out of whack. There's like a little bit of control and potentially regeneration of certain tissues or processes in the body.
And as you've mentioned before, we're seeing a lot more, kind of peptides coming to the market, a lot more getting kind of approval, and there's definitely tons of research that's going on right now at like other peptides. So I definitely see that trend is continuing with more kind of peptides coming to the market, more people, becoming aware of it, and also kind of like more research being done, more peptides hopefully going through that FDA process and getting approved for more and more, conditions, and so that's very exciting.
Yes, I think that'll continue to grow, especially in the United States. I think enough people are interested in it. There's enough chronic conditions that exist in the US that aren't well controlled, and people are ready for like a different approach to maintaining their health. So hopefully there's more and more FDA trials happening, because right now it's kind of like, are they safe? Are they unsafe? Hopefully we can get more kind of like bigger trials to test the safety and efficacy of them. But overall, in our practice, we see them as generally safe, but definitely needs more research.
Yeah, it's definitely exciting, this kind of like new field of medicine that's like evolving, and I think definitely peptides are going to play a bigger and bigger role in it. There are a lot of also influential people who are, big proponents of peptides, who are bringing awareness, more awareness to the market, and it's, between balancing what we already know, kind of what the research has done, and what people are looking for in terms of like new treatments and alternative treatments, but definitely very exciting. So hopefully you guys found that helpful. Make sure you like, subscribe, leave us a comment, and we'll see you next week in the next episode.
Thank you.